4 years after the peak of the COVID-19 outbreak, countries are still facing higher than expected death rates. COVID-19 may be endemic now, but it is still a big killer globally, and we expect it to continue to be a major factor in excess mortality for up to a decade. Our unique global analysis suggests that this ongoing excess mortality is largely independent of countries' healthcare systems and overall population health. In 2023, we estimate that excess mortality was between 3 and 7% in the US and between 5 and 8% in the UK. But what does it mean for the future? Under an optimistic scenario, we forecast a return to pre-pandemic expectations of mortality by 2028. This assumes a resolution of some of the factors driving current excess mortality, alongside ongoing progress in medical advancements and a push towards healthy lifestyles.
Right.
However, if pandemic-related deaths persist, our pessimistic scenario predicts a gradual decline from current excess mortality, potentially remaining as high as 3% in the US and 2.5% in the UK by 2033. But what is driving this future excess mortality? Respiratory deaths from COVID-19, followed by the flu, are the main causes of elevated deaths since 2020 and are expected to remain so in the near future. Other factors that contribute to excess mortality are the long-term effects of COVID-19 infections, which remain uncertain, in addition to some degree of metabolic health deterioration from lifestyle factors. Metabolic ill health, driven by insulin resistance, is now the leading cause of non-communicable diseases, which today make up over 74% of deaths globally. Another factor contributing to excess mortality are healthcare disruptions. During the pandemic, fewer patients visited doctors, resulting in care interruptions and delayed screenings, referrals, and diagnoses. The backlog was addressed quickly, but may have uncertain lasting effects for cancer and for cardiac conditions. On a positive note, medical innovations, including new weight loss drugs and cancer treatments, could offset some of this projected excess mortality. For life and health insurers, excess mortality can impact claims, depending on how these trends affect the insured population. Therefore, life insurers may need to revise their assumptions and adjust their pricing and reserving strategies. Understanding the underlying drivers of mortality enables insurers to proactively initiate prevention programs for promoting longer, healthier lives. You can learn more about our unique analysis and 10-year projections in our new report on the future of excess mortality after COVID-19.